So many times tinnitus is worse or perceived worse at the time of onset, meaning that a lot of times, about 6 months after people have had tinnitus, the brain just naturally kind of shifts and gets to the point that it gets used to it. Not all the times, but a lot of times the brain kind of gets used to it. But when it starts, it can be very detrimental for people. It's a big shift. Something's happened to the body. And again, mentally, this has a lot of impact as well. Your body's not the way that it used to be. And that can throw people into depression. It can throw them into anxiety. And as I spoke about last time, if this is having impact, or if we have issues with that already mentally, it can really cause a spiral. And I see this a lot of times in the practice. So I just want you to, again, to have kind of a self-check and a conversation with yourself, or if you're not able to have that, please have a loved one around you that you can have a conversation with, so you can kind of say, am I at the point that I'm doing okay, or should maybe I talk to my doctor or a mental health specialist? Like, these are some questions to ask myself to say, am I doing okay, or do I need to talk to someone? So some things like, have I felt depressed for more than a couple weeks? Am I not enjoying the things that I used to? Am I wanting to stay at home and not going out with my friends? Have I had changes in my appetite? Am I not eating as much as I used to? Or am I just eating all the time? Same with sleep. Like, am I just wanting to sleep all the time? Or am I not sleeping at all? Like, those lifestyle changes and shifts can be really big indicators that just something's not working the way that it used to, or maybe you need to talk to someone in more specialized areas. But just really be aware if you've had a big change like that in your health, and after a couple weeks you're just not living the way that you used to, you're not getting enjoyment out of things that you used to, please feel free to talk to someone, or maybe even just do a self-check with that loved one. Have those conversations about, I'm really struggling with this. Like, what are you noticing? And please take the accountability. You owe it to yourself, you owe it to your loved ones. And again, having those accountability points is so important to getting the help you need, because getting the help in that arena helps with the tinnitus. So that's my tip for the day.